Hi, I'm Shilagna, your host for today's episode, which is dedicated to urinary leaks or dribbles or incontinence as you will call it, and is very, very common in men. Join us as we delve into the intricacies of urinary incontinence, the causes, symptoms, and the myths around it. Our guest speaker, Dr. Ashish Saini, will be providing us with valuable insights and advice to manage and improve the urinary health.
Thank you for inviting me for this important topic regarding the male health.
So my first question to you, to set a context to this conversation, would be, in common man's language, what is urinary incontinence?
So, urinary incontinence is basically involuntary leakage of urine, and that can occur in two forms. Either it is an urgency incontinence. Urgency is basically, what is urgency? Urgency is a strong desire to pass urine which is difficult to defer. So that is an urgency incontinence, and the other is a stress urinary incontinence, where a patient, when he is coughing, sneezing, if he is lifting a heavy load, if he suddenly gets up, then there is a leakage. So that is a stress urinary incontinence. So these are two types of urinary leakage. The third is bedwetting, where a patient may actually pass urine involuntarily while he is sleeping, and that is known as an overflow incontinence. So these are three subsets of incontinence, and sometimes we may have a mixed variety where a person may have urgency as well as a stress urinary incontinence.
So now we will be doing a round of myths and facts. So you help us burst some of the common myths around urinary incontinence. So urinary incontinence is only common in aging men.
See, there is a misconception that incontinence can occur because of a weak bladder, and it is not the case actually. Rather, a bladder is overactive and it is strong, and therefore a person has an urgency incontinence. The other thing is that sometimes the prostate which is there, which is a common problem, or a UTI which has not been treated, or a surgery which has been done and not been seen in the follow-up, or a neurological problem in form of diabetes, Parkinsonism, a spinal problem, spinal injury patients, or spinal stenosis patients. So all these can actually lead to urinary incontinence. So aging is a part of it, but it is not the only thing. There are other factors also which you have to look into when you are seeing these patients and treating them.
Men should drink less water to avoid urinary incontinence.
Taking excess of water as well as less of water, both are problematic, and it's not there. Rather, if you are dehydrated, then your urine is going to be more acidic. You may also have problems of increased infection, and actually your urinary incontinence or leakage may be more problematic. It may increase rather than decrease. So the key would be a proper hydration rather than over or under hydration.
Diet has no significant impact on urinary incontinence,
because it has been found that if you are taking excess of tea, coffee, alcohol, if you are smoking too much, if you are taking more of processed food like salami or sausages, if you are taking spicy food, all of them are going to cause bladder irritation, and because of the bladder irritation there will be more chances of incontinence. So basically whatever you are eating has a very big role to play, and this is one of the part of the behavioral therapy and the lifestyle modification which we teach patients when we are treating them for urinary incontinence.
Urinary incontinence is a sign of poor hygiene in men.
See, this is also a very, very big myth, and people feel that if they have gone to a toilet which is a public toilet, they have contracted a UTI and things like that. It is basically what is happening inside your body. So you cannot take a bacteria from the surrounding inside your, either it is a sexually transmitted disease or it is something which is happening, a UTI which has not been unattended, or a prostate infection which has not been treated or diagnosed properly. So those are the real causes of UTI rather than just the hygiene. Hygiene is a part of it, but to say that just because of the hygiene problem I'm having this incontinence is not true.
Men with urinary incontinence need medication.
Well, this is also a myth because as I have told initially that men, what we do is we always look into the factors which are there. So there are many factors. Sometimes people may be drinking too much of coffee, too much of tea. They may be taking a lot of cola drinks. So just a lifestyle modification is going to treat them. Sometimes just treating their prostate problems will treat the incontinence. So usually it is a lifestyle and a behavioral modification, and if needed a medication is added to it. So basically what we are doing is we are following a holistic approach of treating patients where we are looking into their lifestyle, looking into the stress, and also a condition which is there in form of prostate or in form of bladder issues or in form of other stone diseases, and then medications are added.
All men with incontinence need surgery to solve that problem.
So that is another end of spectrum. Surgery is basically the last thing to do. We never have an option of surgery as the first thing. Rather, when we have done the lifestyle modification, we have done the biofeedback in form of the therapy like the Jogo therapy which has come now in India. Then we are looking into the disease itself. If everything has been treated with medication and by behavioral modification and lifestyle modification, then there is a very small subset of patients where nothing is working. These are the patients who will be actually a candidate for surgery.
According to you, how psychologically it affects, especially the men when they have incontinence and they see leaks in themselves?
This is basically what we are talking is an incontinence week where we are making people aware about the problems of incontinence. And what we are seeing is that there are a lot of young men who are coming to us with lower urinary tract symptoms, with problems of urination. And I feel that stress has a very big part of it. Most of these men are overthinkers. They are stressed about their life, about their partners, and then they are not coming up to discuss at the right time. I feel that if the intervention is done at the right time, if a counseling is done at the right time, and a diagnosis is made upfront, then these patients, these men with incontinence can actually be treated and their quality of life is going to improve tremendously. So it's a very big social burden where a working person is not able to work properly because he is having a sleepless night, or he is not engaging in a social activity because he is having fear of going to the bathroom again and again. So in such patients, there is help always there and we can help them, but you have to come forward to seek that.
So what would be your, one message to all the men who are suffering from incontinence, young men, senior men, what would be your, take-home message for them?
If you are suffering from incontinence, then better to see a treatment, take an opinion from a urologist nearby and talk about your problems. Do not be scared of going to a doctor that he's going to offer you a surgery. The thing is that we always try to treat the root cause of the disease. We need to follow a balanced diet. We need to be stress-free, and with biofeedback and medication, majority of the patients are able to get treated and get help. And once you come forward, the help is always there and we can treat you and make your quality of life better. Thank you. Namaskar.